Hello, Dennis Carmen, President and CEO of the United Way of Greater Plymouth County for the last 17 plus years. Very honored to be in this role. And I'm here today to welcome you to your participation in our Day of Caring, which is happening on Monday, September 11th, which is a day of remembrance for our country, but it's also a day of national service. So we thought it was a good idea to coincide the beginning of our 102nd United Way kickoff of our annual campaign that we do a day of service. And so you are among 100 volunteers. We're so thankful you're here, going out to over a dozen sites in our community to do some really important community service work. Our United Way is utilizing the dollars we generate through our United Way campaign in order to focus on 5 major areas of need, which are feeding our families, housing the homeless, making sure that people have access to health services, supporting our children and youth, and supporting, our people who are struggling in order to be employed gainfully with job training and placement. So those are the 5 Live United poverty-focused areas of intervention that we are supporting through the dollars we raise. But on this day that you're involved with over these 100 volunteers going out to a dozen sites, we're excited. We cover all of Plymouth County and beyond. And if you look at it, we have last year with United Way resources, we served almost 47,000 people, which is really vitally important because we're trying to reach out to those who are in most need. And my colleague and friend Kim Scotland is going to explain a little bit more about those people that we're trying to focus on and care for in the next segment. So I'll turn it over to Kim now.
Thank you, Dennis. And hello to everyone. Thank you so much for joining us and showing up with us united for our Day of Caring. I want to share today a little bit about the needs that we are seeing in our community. So we all know that the needs in Greater Plymouth County are immense, and we can tackle them best when we work together. And my role is to share with you a bit about what we're seeing and how we're working to meet the needs. So at United Way of Greater Plymouth County, we pay close attention to the pulse of our community, and we work closely with 47 terrific initiatives that we're funding at our 25 partner agencies through our Live United Fund. We also utilize data from community needs assessments, and we're in frequent communication with all of the United Ways across Massachusetts to align our priorities. So a little bit about what we know here up on this screen. According to the U.S. Census Bureau, 7.5% of individuals in our service area are currently living in poverty, which is a heart-wrenching statistic to think about, and unfortunately, it's on an upward trend. The Massachusetts Department of Public Health's COVID-19 Community Impact Survey found, sadly, that 44% of individuals in Massachusetts are worried about paying at least one expense or bill over the next few weeks, and this number skyrockets to 67% of those with an income under $35,000. You'll see some other data up on the screen here, and in summary, I want to share from the needs assessment. Some of the top needs that we're seeing are affordable heat, utilities, and housing, food and nutrition, transportation, mental health, substance use, and early education and childcare. So now that we've identified some of the needs, we want to talk briefly about what we are doing with them. So United Way fills the gaps. We convene and we advocate. We're an active member or leader of many regional coalitions in the categories of health, education, and financial stability in our region. We prioritize all children and families in the 22 communities that we serve. Looking at our 5 intervention focus areas, together with our life-saving partner agencies, we are making a real impact. I want to share some data with you, and you'll see here a collage of photos that we have from our funded partner agencies of some of what we accomplished together over the last year. So going through our 5 categories of intervention and the categories of families fed, 9,780 children and youth obtained healthy food and nutrition that they may not have otherwise had. 1,931 individuals and families are no longer food insecure. Housing and shelter, 148 individuals in crisis were able to avoid utility disruption, and 208 families or individuals were placed in housing. In the category of access to affordable health services, 339 people receive preventative care support leading to healthier lives, and 451 people receive behavioral health services, also leading to healthier lives. Support for children and youth. 15 youth graduated high school in the last year through United Way support. 1,182 children received literacy support, leading to greater success at school. And lastly, in the category of support for job training and placement, 146 people were helped with financial education, literacy coaching, or other services in order to receive a job. So together, we know that we are creating lasting change and advancing economic opportunities for all. But we also know that there is much more to do, and we need your help now more than ever. We know that when we supply needed resources to our communities, positive change can happen. And I would love to end my segment of today's presentation by sharing an example of this positivity. So I have a story here about a woman that we helped to serve by the name of Arlene. And please note that we changed her name to protect her privacy. So without further ado, here's Arlene's story. So Arlene attended a budgeting workshop that was funded by United Way of Greater Plymouth County's Live United Fund, conducted by one of our partner agencies at a low-income apartment complex in Plymouth. After attending the workshop, she scheduled a one-on-one financial literacy counseling session. And during this session, she shared that she was struggling to pay her bills and she was consistently late with her rent payment. Through a complete budget and debt assessment that was conducted by our United Way partner agency, the counselor helped Arlene by recommending specific cuts she could make, as well as increasing her income by helping her to find a part-time job. Arlene has now paid her rent on time for 3 months in a row. She's sticking to her budget and she's able to support her family. And stories like this really, I think, show us all the tremendous impact we can make when we're working together. So it is now my pleasure to turn it over to my colleague, Lisa Machowski, who is going to share some more information with us and wrap up our presentation today.
Thank you for volunteering and sharing your financial gifts with United Way. Your generosity allows our allocations panel volunteers to fund food pantries, daycare programs, elder in-home health care, job search assistance for neighbors with developmental disabilities, and more throughout the 22 communities of Greater Plymouth County. This year's fundraising campaign kicks off September 11th. When asked to give, please remember your neighbors experiencing homelessness, single moms who need safe childcare so they can work a full-time job, a challenged teen requiring a new set of clothes for a job interview, or a lonely elder at home waiting for their visiting nurse to stop in. Please give generously. Thank you. Join us in living the United Way with our 2 events that are coming up this fall. Our first event is Sari Sari Night, a fundraiser at Bridgewater State University on October 4th. Or consider purchasing a coat through our Warmer Winters Fund for children and youth most in need in the Greater Plymouth County area. Keep them warm on their stroll to school this winter. To stay in touch with us, just follow us on social media, sign up for our e-newsletter, or join our texting list. Go to uwgpc.org for ways to connect. Thank you.
Living the United Way.